Hello, I'm Susie Sell. I'm here at Richmond House in Westminster, where earlier I talked to Professor Steve Field about his second NHS Future Forum report. I wanted to know what the key recommendations were and what was next for the NHS Future Forum. Now, a major recommendation in the report is the suggestion that health professionals should make every contact count and ensure that they use every patient consultation to advise about healthy lifestyles. The recommendations already come under fire by Claire Gerardo, who said patients might be put off if GPs start lecturing them about this. I mean, what's your response to that kind of criticism?
Well, first of all, Claire hasn't seen the paper yet, and so I look forward to her comments when she's read the paper. But the basic training that a GP has now, it's all in the curriculum, is about using every contact to talk about prevention as well as the diagnosis and the treatment. So it's something GPs are doing anyway. So what we're calling for is nothing new for GPs, but this report isn't just targeted at the GP population, it's also for pharmacists, for dentists, optometrists, surgeons, nurses. And so an example would be if you were a surgeon and you were looking at a patient who'd got vascular problems, it's obvious you would want to talk about their smoking because it would have an adverse effect on their blood vessels, and we know that there's variation in the number of people who are being subjected to amputation of legs. So the opportunity for a surgeon to talk about smoking is a sensible one. In general practice, it might be that someone's coming to talk about sexually transmitted diseases, and there's an opportunity there to talk about alcohol. What we're not talking about is a checklist to talk about every lifestyle intervention, but to target and to use the opportunity.
Fantastic. There was also the suggestion in the report that patients want to ensure that NHS staff have their own house in order before they start telling patients how to improve their lifestyles.
Yeah.
Is that the suggestion that GPs and other health professionals shouldn't be overweight, they shouldn't be smokers, they shouldn't drink to excess?
Well, I think there's two aspects to that. One is about our own health and lifestyle, and I struggle with trying to keep my weight down, so and exercise, and perhaps a lesson for me would be that I need to exercise more and think about my diet more, and I think about it, but that's something for our own health, because if we're healthy and active, we're more likely to provide a good service for the patients and also act as good role models. But I think we're also very keen on looking at how the NHS supports its employees, nurses and doctors in hospitals and in general practice. And again, Claire Gerardo's done some fantastic work with her surgery looking after sick doctors. Now that sort of service should be rolled out across the country. We should have a better occupational health service for NHS employees, and we've seen some fantastic examples of this. Mostly in hospital. One of the difficulties is when you're out in general practice and in dentistry, and so what we would like to see is a bit more focus on how we look after ourselves as individuals and how the NHS looks after ourselves as employees as well.